Sorry, one sec.
Off and
okay, I think we can start admitting people from the waiting room, and I will just let everyone know that we will start at 7.
All right, so I'm gonna start admitting people now.
Sounds good. Thanks, Jerry. Hi, everyone. Thanks for joining. Just a little bit of housekeeping as people are trickling in. Please enter gallery view to optimize your viewing experience for this webinar. The instructions should be found on your screen, and we will get started in just a moment, promptly at 7 p.m. Eastern, and we will aim to conclude exactly at 8 p.m. Okay, for the sake of time, I think we can go ahead and get started. So hi, everybody, and welcome to the VESS VSIG's third event of the year on research and mentorship in vascular surgery. Thank you so much for joining us today. My name is Kate Kim, and I'm a fourth-year medical student at Rutgers Robert Wood, and I applied to vascular residency programs this year. So before we get started, I just wanted to mention, as you may have noticed, that this event will be recorded. And if you need to leave the event at any point, it will be available to view on our YouTube channel at a later date. For those of you who may not be familiar with our organization, the VESS VSIG was started as a national forum for students interested in vascular surgery to participate in, specifically focusing on students at institutions with no home VSIG program to receive continued vascular exposure and mentorship. Our Discover series in particular aims to reach students in their preclinical years, so predominantly M1s and M2s who are considering specializing in vascular surgery. Tonight's event was sponsored by the Discover group, and we really met as a group and came together and chose this topic because we felt as if it was timely for M1s and M2s who may be beginning to think about research opportunities and summer projects. Tonight was designed so you can hear from fellow students as well as attendings who will share their own research experiences and relationships that they have had as a mentee and mentor.
Thank you, Kate. Good night, everyone. I'm Cayetana Lascano. I'm a second-year med student at PHSU. Tonight, I have the honor to introduce our student panelists. Our first student speaker is Prashant Saini, a fourth-year medical student and current integrated vascular applicant at George Washington University School of Medicine. Prashant started off doing research with the ENT department and did some medical education research with the Dean's department at GW. He later joined the vascular research team at GW due to the lack of VQI and formal vascular residency and fellowships at GW, he had to propose independent projects and reach out to mentors he met at BAM and away from more research opportunities. Prashant is currently working on a study looking for the need of emergent surgery in venous thoracic outlet syndrome. Thank you, Prashant, for being here with us tonight. Please give us a quick hello.
Hey guys, you kind of heard who I am. My name is Prashant, fourth year medical student at George Washington. And I'm happy to be here to talk about, the importance of research and mentorship in applying vascular surgery.
Thank you very much, Prashant. Our next student speaker is Brian Leosi. He's a fourth year medical student at Rutgers, New Jersey Medical School, and has applied to vascular surgery integrated residencies this cycle as well. He got involved in vascular surgery as a senior in high school and has been published in multiple times in both JVS and Annals of Vascular Surgery. He has presented at national conferences, reading a textbook chapter, recorded episodes for Audible Bleeding, and started a vascular surgery interest group at his med school. Thank you very much, Brian, for agreeing to participate tonight. If you can please give us a quick hello.
Yeah. Hey, everyone. Happy to be here. Thanks for the invitation to talk. And it's good to see some familiar faces on the panel as well. So looking forward to it.
Thank you very much to the both of us. Now I'll pass it to Thomas, who will be introducing our faculty panelists.
My name's Tommy, and I'm a second-year medical student at Loyola University Chicago Stritz School of Medicine. Tonight, we have an amazing group of panelists with us here, and our first panelist is Dr. Bernadette Alivola. Dr. Bernadette Alivola is the professor of surgery at Loyola University Chicago Stritz School of Medicine, and she's the director of the Division of Vascular Surgery and Endovascular Therapy at Loyola University Health System, and the vice chair for diversity, equity, and inclusion within Loyola's Department of Surgery. Dr. Alivola has served in numerous leadership roles over the course of her career, including the vice chair of the SVS Task Force on DEI, the chair of the SVS Resident and Student Outreach Committee, and chair of the newly formed DEI Committee of the Midwestern Vascular Surgical Society. She currently serves as the treasurer of the MVSS. Dr. Alivola has served on multiple additional vascular surgery society committees, journal editorial boards, and as an associate editor of the Rutherford's 10th edition textbook. Dr. Alivola has a broad clinical practice, including the management of peripheral artery disease, aneurysm disease, carotid disease, mesenteric and renal artery disease, AV access, venous disease, including pelvic venous disorders, and spine exposure. Her research interests are broad, but include health disparities, particularly in the management of peripheral artery disease. Dr. Alivola, thank you again for being with us tonight, and please give everyone a quick hello.
Hi, thanks, Tommy, for the introduction. I'm happy to be here tonight. Hopefully bestow some wisdom in the area of getting involved in research early on. So I'm happy to be here. Thanks.
Thank you.
Hi, everyone. My name is Elizabeth Lavanga, and I'm a second-year medical student at Penn State University. And tonight I have the pleasure of introducing Dr. Lee. Dr. Lee is the Chief of Vascular Surgery for Stanford Medicine and former Program Director for the Stanford Vascular Residency and Fellowship. He served as immediate past president of the Vascular and Endovascular Surgery Society. He has also held many leadership roles in the Society of Vascular Surgery, Society for Clinical Vascular Surgery, Western Vascular Society, American Heart Association, and American Board of Surgery. Dr. Lee champions clinical and translational research and promotes many early career trainees and faculty in their research pursuits. His research findings have helped advance minimally invasive endovascular aneurysm repair and other surgical procedures. He has made nearly 600 presentations worldwide, including 200 peer-reviewed abstract presentations at meetings, co-authored dozens of book chapters, and published more than 190 articles on innovations in the treatment of aortic aneurysms, vascular trauma, deep vein thrombosis, and athletic vascular disorders. Stanford's training program includes 2 years of professional development and research and has a long history of nurturing future vascular research center careers. Thank you for being here. And if you'd like to say a word, the floor is yours.
Yeah, no, thanks. Happy to be here this evening and looking forward to a lively discussion. Hope there's a lot of questions.
Thank you, Dr. Lee.
I realized I was speaking without unmuting myself. Hi, everyone. My name is Kushi Patel, and I'm a second-year medical student at Rutgers Robert Wood Johnson. And I'm excited to introduce Dr. Matthew Smets. Dr. Smets is the editor-in-chief of the Journal of Vascular Surgery, Cases, Innovations, and Techniques. He's a tenured professor of surgery and the former division chief of vascular and endovascular surgery and program director of the Vascular Surgery Fellowship at St. Louis University in St. Louis, Missouri. In addition to a busy clinic practice, he is interested in outcomes research in vascular surgery, surgical education, diversity and equity in surgical training and practice, and use of social media in vascular surgery. He has been active in multiple societies, including the Society for Vascular Surgery and the Vascular Endovascular Surgery Society, serves as examination consultant for the Vascular Surgery Qualifying Examination, and is an associate editor of Lawrence's Essentials of General Surgery and Surgical Subspecialties. Dr. Smets, thank you so much for joining us today. Would you like to say a few words?
Yeah, thanks for having me. I think it's going to be a great discussion, great co-panelists, and I feel awed in their presence.
Thank you so much. I think we're ready to move on to our questions.
Hi, everyone. Hi, everyone. My name is Liana. I am a second-year medical student at the Penn State College of Medicine. Now we're going to move to the question and answer portion of the evening. Each questions will be directed towards specific panelists, but to all the other panelists, if you have anything to add, just feel free to chime in. My first question is going to be to Brian. This is like a 3-in-1 question, which is, how do you identify a mentor? How often do you meet with your mentor? And what do your meetings entail?
Sure. Thank you for the question, Liana, and hopefully I can give a pretty robust answer to this. I got very lucky in finding my first mentor in vascular surgery, and that honestly happened very serendipitously and very organically, but I know that that's not the case for everyone here tonight, especially those first and second year medical students. For those of us who are actively searching for a mentor, I think there are a few concrete ways of doing so. The first, of course, being that reaching out to faculty at your home institution. But for those students who maybe don't have a home program or have a strong home program, I think the second most common way to do that would be to attend national vascular surgery conferences and do some networking there. Vascular surgery is one of the most technologically evolving fields, but it's also one of the smallest. And, I went to 3 national meetings this past year in 2022 and would consistently meet and talk with the same faculty, made a lot of friends who are current applicants right now. And the good thing about all of these meetings is that you don't have to be presenting at them in order to attend. All of these conferences have scholarships for students to go and learn about the field and do some networking. And for example, at the Vascular annual meeting this past summer in June, they had a dedicated mentorship program that paired up students with faculty from around the country. And I think in this post-pandemic world where Zoom meetings have been normalized, it's more possible than ever to have a mentor who's not necessarily in the same physical space as you are. I think finding a mentor is one thing, but finding a good mentor is another. I think the most consistent thing that I found across my mentors over the years is a universal excitement for me to be learning about vascular surgery. You want somebody who's demonstrating a clear interest in you and your professional success, however you define that. With my mentors here at Rutgers and JMS and in years past, we end up meeting, I would say on average about once or twice a month, but everyone is busy at this stage in the game, whether you're a medical student, a resident, or a faculty member at that institution. And I think stuff happens, life gets in the way, and it's important to be flexible and understanding if you have to meet more or less often with your mentor. And if I could just leave everyone with one shred of insight tonight, just to impress the fact that it's okay to change mentors and maybe have more than one mentor. At the end of the day, we're all adult learners and responsible for our own path to success. And along the way, you will have multiple professional relationships with people. And so having multiple mentors is okay. And I would think even to be encouraged, because especially these days where you have the integrated pathway and the traditional path with the fellowship, everyone has their own unique background and their own life experiences and wisdom that they can impart on you.
Awesome. Thank you so much for your answer.
I can make a couple of comments here as well. You know, I think that there's great opportunity in identifying young faculty, because oftentimes the younger faculty are really hungry to be productive. And if you come into them willing to do some work, I think they're going to jump at that opportunity. So you don't necessarily have to go for the big name in the department or the division. You might find the big name people are a lot more busy and less able to mentor you like you really need to be mentored. And then another point I'd like to make is that I think if the student comes with a well thought out idea, that really goes a very long distance in establishing a research connection with the mentor, especially if it's something that mentor studies. And if you're more invested in the project because it's something that you're personally interested in, the project itself is going to be established a lot easier with your mentor. So identify some young faculty that are hungry to be productive. Identify a project that you think you could do, or a question you'd like to answer, or an interest of yours that you think you could bring to vascular surgery, and then approach a lot of people and try to find the best fit. Oh, and one other thing is there's a lot of mentorship programs out there. Society for Vascular Surgery has a mentor match. You can go online if you don't have vascular surgeons at your institution and find somebody that they could match you with, and you can sometimes get research projects done that way.
Thank you so much.
Hello, my name's Thomas. I'm a first-year medical student at Case Western Reserve University in Cleveland. And this next question, we're going to be presenting a scenario to Prashant. And supposing that we have a medical student who is going to a home institution that does not actually have a vascular surgery program, first of all, how would such a student get involved in research, and how would that student identify a potential research topic?
Yeah, I'd love to answer this. So I go to an institution without a home integrated program and without a fellowship as well. So just, I think a little bit of my background has already been stated, but I discovered vascular surgery during my third year surgery rotation. And I was lucky that we actually do still have a vascular surgery department at our home institution, and they do research. So that's kind of how I got plugged in with vascular surgery research. So I would say, even if you don't have a home integrated program or a fellowship, you probably still have a vascular surgery department. And kind of to Dr. Smed's point, if that department has younger faculty, they're probably still conducting research. So, reaching out to those faculty is a great way to get involved with research. Another way to get involved with, vascular surgery research, if you don't have a home department, is going to these conferences. And you might not even have like an abstract to present or anything like that initially, but, as a first and second year student, going to these conferences and networking with mentors that are active in the academic field is a great way to get connected to these mentors and, find mentors outside your home institution to do research with. So, going to conferences like SVS, VESS is a great way to find other mentors. And I guess the last thing I would say is, at least my experience on my interview trail is, you don't need to have, 10 publications in, JVS or Annals of Vascular Surgery to apply to integrated vascular surgery. A lot of my interviews did ask me about my prior research in ENT and surgical education. So as long as you're able to talk about research in other fields, it's not always like a bad idea to do research in other fields. If you have a really productive bariatric surgery department, for example, and you have even a cursory interest in bariatric surgery, then getting involved with them early isn't, the worst idea. No one's going to knock you for having, 5 publications in bariatric surgery.
I like the fact that you bring up the focus on just getting to a meeting, and there's so many benefits to that. I mean, you've attended VAM, right? So you know that if you're just simply present, you're surrounded by science and research and education. And I think as a first-year student, oftentimes if you haven't had experience with vascular surgery, it's hard to, you're just learning about what the field is about, right? So come up with the research idea, may seem overwhelming. But I think the meeting really offers an opportunity not only to network, but also just to see what we do, right? So that research can happen in the clinical outcomes domain or surgical education, or so many different areas that you wouldn't necessarily think of if you were just learning about what vascular surgery is.
I'd also add, that if you have a personal interest that you don't think jives with vascular surgery, it might, So I had a student come to me a few years ago, and they were a nutrition major, and they were really interested in nutrition. And so we developed a project kind of looking at nutrition in vascular surgery patient. I had another student who had an interest in, of all things, medication compliance. And so we looked at medication compliance in vascular surgery patients. And so bring your personal interests to the surgeon and try to meld the two. And I think you'll have a really good project. And then, like Prashant said, if you haven't done research in vascular surgery, it's not the end of the world. If you're doing research in something else, we like to see research in general. It says that you're looking at a topic in detail. You're learning how to look at the literature, and you're learning the research techniques. The fact that you don't have necessarily vascular research necessarily won't hurt you. I remember I was interviewing for medical school, but I had done research before that on the sexual selection in field crickets, of all things. And I still had a good conversation with the people I was interviewing with about that topic. So do research in whatever you can get the best research done in.
Yeah, thank you so much, Prashant, for getting your insights. And thank you for everybody that chimed in. We really appreciate you guys taking the time to help us out with this.
In our next scenario, if I'm a prospective applicant to integrated vascular surgery residency programs, I would like to ask, how important is the research? And specifically, we would like to ask, do you have to be a first author of a paper to have a strong application? Is quantity or quality of research more important? And do you need to take a research year to apply to the 0+5 programs? And we would actually really like to ask all our attendings present to answer this question. So Dr. Smeds, Dr. Lee, and Dr. Olivola, you can chime in and perhaps give a few words on your thoughts.
And maybe I'll start with this one. I think these are great questions. I think students often want to know how involved to get. I actually wanted to reiterate something Dr. Smed said earlier about when you're identifying a research person, finding the younger, more hungry, was the phrase he used, attendings to help with a project allows you to be more involved. And that probably helps you move up, perhaps, if you will, in the order of the paper. And it could spin off if you wind up having a significant impact on the work. Other papers will come out of it that then will show kind of sustained interest in one topic. I think these days a lot of people are doing gap years anyway to apply. At least what I've noticed is, I certainly couldn't get into my own program now based on med school performance. So clearly the competitive nature has gotten a lot bigger. And I think that, whether you take that research year off or not, it just make it a meaningful year where you're productive.
Yeah, I agree with Jason. It really depends also on the programs you're applying to. Stanford has a very well-established research reputation. They have years out for doing research and professional development, but not all programs are like that. And so depending on where you apply, you might not need all these, NIH funded research projects on your CV. But I think as far as your quantity versus quality, I think quality for me is more important. If you're a first author on a paper, that looks a lot better to me than if you're the fourth author on 15 papers. And whatever it is, whatever the research you do is, you need to know it, because you will be asked about it on the interview trail. And there's nothing worse than if you have a paper and you get asked about it and you don't really know what the paper's about. That'll look 10 times worse. And so Even these papers that your 5th, 6th author on, you just did a little data collection on, make sure you read the paper, you understand the paper, and you can discuss the paper. That's a really important thing for going into interviews, is knowing what's on your CV, because you can hurt yourself if you don't really know the research that you say that you did.
I think it's important too to sort of set some expectations at the beginning of a project. I'm a huge fan of laying out, okay, how much time, if I meet with a student interested in research, how much time do you have to spend on this? What experience do you have? How motivated are you? And I think it's sort of nice at the outset for the student to, sort of lay out whether they feel like they have the background and the time to put into, the majority of the work. And oftentimes we're sort of establishing expectations in terms of where you'd be on the author list in terms of, how much work you put into the project. A motivated student who is doing the analysis, submitting the IRB, doing all the lit search, writing a manuscript, is going to be the first author on that paper. So that's something you can decide. And sometimes, depending upon where you're at in your coursework, maybe you just have a few hours a week to help with, data collection or something. But sort of planning that out ahead of time, I think is nice.
Yeah, and be proactive, keep on bugging the attending surgeon that you're doing research with, to push the project forward and set deadlines. The timeline you need to set is that, the VESS abstract deadline is due in September usually. So have your abstract ready by the end of August so you can submit to VESS. That's the most important timeline for you to have. And so you really need to be proactive for your research and keep on pushing the elephant, keep on pushing the ball forward.
Great. Thank you all so much for your responses.
Everyone, my name is Brandon Kreischer. I'm a 3rd-year medical student at Thomas Jefferson University. My question is for Prashant and Brian. I was wondering if you could tell us how you balance your time in medical school with research and other responsibilities. So we can start with Prashant and then we'll move to Brian, please. Thank you.
Yeah. So yeah, research is just like having another class, honestly. Depending on what your role is on the project, that's kind of how you're going to decide, how much time you need to allocate. So, for some projects, especially as a first year, it's your first project and you're tasked with doing the lit review or, writing the introduction or something like that, that doesn't take as much time. So you can do, when I was tasked with something like that, I usually did my schoolwork for the day. And then like towards the end of the night, I kind of like worked on it. But for projects where I was the lead, where I had to do a lot more like, collect the data, analyze the data, write up the project, do the lit review, where I had to do a lot more. There were days where or sometimes even like, entire weekend where I just did research. So I would say, just kind of consider it like another class, basically.
Yeah, I mean, I agree with Prashant, and just, going off of what all of our faculty panelists had said, you really need to be proactive when it comes to research. You need to set expectations for yourself and for everyone working on the project early on. It can be a lot, and I understand that medical student perspective of being, coming off like a 12-hour shift on your surgery clerkship, being very tired, still having to study for your exams, your shelves, potentially step 1 or step 2. I understand that it can be very worrisome to figure out where you can fit in the research, but I think part of that is also your responsibility to understand your own limitations and to learn how to delegate. If you don't necessarily have the time that's needed for a certain aspect of the project to be able to ask for help and recognize that you need the help to finish that up. And also, learning how to say no is a skill. I think when you become very familiar with your faculty mentors and the projects start piling on, it can be very tempting to just get that quantity of research done. But at the same time, it might detract from the quality of those research papers. And I think, like Dr. Smed said, on your interviews, I can speak from personal experience, you will be asked, to talk about your research projects and what your role was in them. And I think it, speaks volumes if you can say that you were the one involved in the inception with that project, with the data collection, the data manipulation, the manuscript writing, getting it sent to the journal, presenting it. I think having like those one or two projects where you're very involved is a lot more important than crunching your time and maybe detracting a little bit from each individual projects if you're getting overwhelmed.
I'd also add, I'm adding to everything here for some reason, but I'd also add that you are in medical school to learn how to become a doctor. And so your education should take priority over research. It might be a controversial thing to say on this webinar, but you're there to learn about becoming a doctor. And so just keep that in mind. And the other thing is, I've done a lot of research on burnout and things like that. You don't want to get burnt out. So don't kill yourself, trying to get all this research and doing great in school. You need to take some time for yourself. Again, maybe a controversial statement in this webinar, but try to find that balance between the schoolwork, the research, and your personal life, and make sure you try to get all three of those things done.
Yeah, research is
Can I flip that? I was going to make a comment on Dr. Smed's depressing take on that. No, I'm just joking. I was just going to add that, research can also be invigorating. I was thinking about some projects that Dr. Smeds and I have done together where, it's collaborative and you can involve students or faculty from different institutions. And so, find the fun in it as well. So.
Yeah, research is definitely the icing on top of the cake, and everyone loves icing. But you kind of need to have the layers of the cake as well before you can put the icing on. And so, like everyone's saying, getting your step scores, the shelf scores, your clinical evaluations, your letters of rec, that's all, I would say equally or potentially more important than, having, multiple first authored publications.
Great. Thank you all for those answers. It's really helpful.
I can go ahead and present this scenario. So in a situation where I am an M1 who is just getting started in research, like I know a lot of you on this call may be, we're curious about what sort of timeline we might be looking at. For instance, when should you start to identify a research project? When should you have a mentor by? What are some important funding deadlines, maybe at a local level or on a national level? And Dr. Olivola, I will direct this question to you.
Yeah, well, Dr. Smed sort of alluded to this a little bit earlier in sort of establishing a timeline based on abstract deadlines. In my mind, there are several deadlines all throughout the year that I'm usually, thinking about wrapping up projects in order to submit for abstracts. So if I sit down with a student, we're usually sort of setting an endpoint. Okay, this is not a project that's going to be, if it's a clinical outcomes project and you can collect data and do an analysis in a certain timeline, that setting a goal for the endpoint is helpful. Maybe that's a little bit different if you're prospectively enrolling patients or still you have some timeline. For first year students, I can speak for what we do here. I mean, the VSIG is a wonderful way of faculty and students getting sort of talking about research early on. So if you're, hopefully most of the people on here are involved in a vascular surgery interest group, and we start talking about research early in the MS1 year. And we have sort of a timeline for planning a project for the summer break between first and second year. So we're usually, in discussions, we just submitted a few proposals with a few MS1 students who'll be working with me over the summer. And those sometimes are tied into local deadlines. So in terms of funding is great. There are, I think you'd have to look at what's available locally. Our School of Medicine has a T35 program that funds research that we tend to do during the break between first and second year. There are also funding opportunities in the national and regional organizations. So for example, the SVS Foundation has a student-focused research award. One of my prior students was lucky enough to receive that. And the deadline is coming up soon, actually, it's in February. And that's sort of requires that you've done some pre-work, you know, right? You have a proposal, perhaps you have some background and you've done some work in that area. Most of the regional societies have some form of avenue to get engaged in research. Our Midwest Vascular, for example, has a student research award that's focused on diversity in vascular surgery. And there are lots of, I don't know all the opportunities around, but I say search your regional and national societies for opportunity. And then also look for student scholarships to get to all these meetings so that you could start networking with people that you might be able to collaborate with. So all of the regional and national societies, most of them have student-focused programs. And so that's, again, another opportunity to just get engaged with a mentor that might not be at your home institution.
Great. Thank you so much, Dr. Olivola, for that insight. These all sound like great resources.
You know, I'd also add, because I need to add to every question, is that when you're looking at your timeline, make sure you take into account the IRB, because you're not just going to be able to start doing your project at the time you want to do it if you don't have IRB approval. And so, you know, I've had students who were interested in doing summer research and they were delayed in getting the IRB submitted, and then they just sat around twiddling their thumbs. And so take into account the IRB and the approval process for the research you're going to do in your timeline.
That's a great point, and that probably varies from institution to institution. But here we're looking at submitting IRBs in about March, you know, for a summer project. So that's really important. And then thinking about you know, completing city training, or you know, training in research ethics, which is oftentimes mandated in order to engage in research that involves human patients.
Yeah, and access to the electronic medical record if you're an M1 and you're doing a, you know, that kind of project. So you need to take into all these things into account.
The other thing about the balance is some schools offer the opportunity to do a research elective later in your clinical year. So maybe you have a project you've been working on, you just want to do a whole bunch of work on it, to take a block during your clinical year as an elective research month where you could just focus on that is one nice way of sort of balancing all the things together.
Great, thank you.
Hi, everyone. My name is Vaishnavi. I am a first-year medical student at East Carolina University, and this question is directed to Dr. Smeds. If I'm all set up to begin my research during the summer of my preclinical years, what should I be looking to gain from my research project?
Well, you know, I think the most important thing in my mind for a summer research project is doing a project that you can complete in the summer, or at least get a good portion of it done in the summertime. We've already alluded to the, you know, the VESS abstract deadline in September, but that is a nice, you know, deadline if you're doing a summer research project to have an abstract done by September. Because you know, if you can get it completed or a good portion of it completed, then you can go back to school and kind of focus on your coursework. I think other goals for your summer research project is to get experience in vascular surgery. So if you're taking time to do a project with a vascular surgeon, take some time and go to the clinic with them, go to the OR, go to the interventional suites, and see what vascular surgery is all about. Because this is your opportunity. You're working with a vascular surgeon. You might as well see what we do on a day-to-day basis, especially if you haven't had that experience. So those would be the two kind of big things that I'd say. I'd be curious what, Jason and Bernadette have to say about a summer research project. I'm sure you've done a lot of those with students over the years.
Well, I think the nice part is that they align perfectly with a few important deadlines, right? The VESS and the SCVS, two national organizations, their abstract deadlines are right in the beginning of September, end of August area. So it just aligns perfectly to get an abstract together and have a goal for the end of the summer.
Yeah, vascular societies are real nice because they're spread throughout the year, right? So you have VESS and SCVS in the fall, then you have the SVS in January, and then you've got, for us, we have Midwest in April, and then in summertime, you've got American College of Surgeons and a couple other academic societies. And so you can kind of have stuff going all year round and have abstract deadlines all year round if you're really productive. So it's just kind of nice.
Yeah, I also think, to get back to Bernadette's earlier point, you want to set the expectation when you're meeting with them. And if it's a summer research project, you might want to say, yeah, I'd love to be able, I know there's a deadline in September. It'd be great if I could have a project that is even finishable in that time period. So I think you have to, there are some projects that are year-long projects that you get involved in somebody's lab. And there are clearly ones where there's perhaps a question you noticed because you were shadowing in the clinic or shadowing in the OR, and you ask a question that can be answered with a summer research project of looking up 50 charts. So just set that expectation early was the thing I heard earlier about how involved you want to be in the project. So the goal should be that you get a finished project so that when you come for interviews, you can talk about, because you'll get asked, tell me about a project that you worked on and what impact that had on you.
Also, if you're doing a summer research project with a vascular surgeon or any kind of surgeon, keep your eyes open for other opportunities. You might be working on a certain project, but case reports will come up, or helping out with other projects might come up, and you can get your name on other papers. And so take the opportunity to kind of be proactive and look for other opportunities in addition to the one project that you're working on with the surgeon, because there's always interesting cases that come up that can be written up and submitted to the JBS CIT. And it's a great opportunity for you.
Or a lot of the meetings actually accept case reports or case descriptions, videos, and other things. So it's not necessarily, a year-long project that culminates. And then, well, I'd love to say every abstract we submit gets accepted. They don't. So, you'll submit something and it doesn't get in, but maybe you decide to read the paper and submit it, or submit it to another meeting. So, so sometimes that project goes a little bit longer than maybe you anticipate.
Thank you all so much for your responses.
Hello, Cayetana Lascano here again. This next question is for Dr. Lee. If I had a research project or relationship with a research mentor that didn't exactly pan out, what should some of my next steps be?
Yeah, that's an interesting question. I've actually, as I was reading through some of the questions, I have had some, personal experience where a visiting student comes out, wants to get involved in something, and through either usually just a lack of connecting over time, they left and then didn't have access anymore to look at charts or to the team. I think this sort of inevitably can happen. Again, I just really like Dr. Olivola's earlier point about setting expectations when you engage in a project. And hopefully the mentor is realistic too. Like, I think this is going to take longer than the month that you're here as a visiting sub-I or as a visiting summer research student. So you'll need to stay engaged over the year, and maybe once a month when you've gone back to your home institution, we can still find time to Zoom. I think the pandemic and making things virtual has really helped us to stay in communication with mentees around the country. So we should take advantage of the technology to do that. Most lab meetings now for people's individual labs are done over Zoom. So a lot of people can get invited to participate in those things. If it doesn't work out, I think it's okay. Move on to the next one. Don't dwell on it, if you will, much like a lot of ideas you have in med school or ideas you have as an undergrad that didn't really work out. That's okay. Move on to the next one, I'd say.
I agree. Those are some great points by Jason. The one caveat I would say is make sure you follow up with the surgeon that you were working with, because sometimes they get busy and they drop things. For example, I had a student that reached out to me a few months ago, had proposed a project, and I was kind of gung-ho about it. I had actually responded to him and I never hit send. And it was sitting in my composed mailbox. And so he could have taken that as a sign that, the project was dead and it wasn't going to go anywhere. And he followed up with me again and said, just wanted to make sure that, you didn't have any other thoughts. And I was like, yeah, I responded to this, and I looked and I hadn't even sent the email. So follow up with the person and make sure that the project really isn't panning out before you kind of cut all ties, because it might just be a miscommunication or a ball dropped by the attending.
Thank you very much for your responses. I'll hand it over to Jerry for the next question.
So I think Tommy's going to take this question first.
So we're just going to be moving over to any chat questions that kind of pop in for the panelists. So our first question, maybe we could direct it to Dr. Lee, is coming from Ashley. She says, looking forward to how the field may evolve. And I'm wondering if any of the panelists could speak on how / if they see genomic medicine integrated into vascular surgery research and practice. And if they do, how do you start an interdisciplinary research in that area?
Yeah, that's a pretty heavy-handed question, and very sounds like you're reading current literature. So genomics, as everyone knows, is obviously studying through patients' blood samples predisposition to various vascular disorders. It's a hot topic right now. Folks that follow Stanford Vascular know that we've got that I have a junior faculty member, Derek Claren, that just published in Nature Cardiovascular Medicine last week on the Million Veterans, the Million Veterans Project, where we've been able to sort of accumulate blood on samples and look for risk factors for people to develop PAD, aneurysm disease, and carotid disease. I think there is a huge ability for genomics to help teach us a lot. As you correctly point out in this question, it's a multidisciplinary effort. You need geneticists, you need blood bank typing people, you need the surgeons, you need sort of epidemiologists, you need big data people. If you're really interested in that, this again comes down to what Smeds pointed out earlier. As you look at different programs, everybody's going to have strengths, pluses and minuses of an institution. If you're dead set on some aspect of vascular surgery, and the place that you're very interested in for whatever reason, geography, a mentor there, if they don't have those aspects to help you with your research interests, it's going to be an uphill battle. So while you can do your homework too of making a list of plus and minuses, if there's something you're really interested in, try to match up the resources with that. Something like genomics is only going to be in a couple of places around the country.
Thank you, Dr. Lee, for that insight. I really appreciate it. And then we'll move to Jerry to ask for the next question.
Hi, my name is Jerry Zhu. I'm a second-year medical student at Sinai doing research here with vascular surgery. I'm going to ask Dr. Hahn's question, which was, if a student has completed a project in vascular surgery but got rejected when submitted everywhere, is that salvageable to show programs that the time is still meaningful, or is that time down the drain?
I think sometimes getting a good outcome out of the work put into a project can hinge on having another set of eyes take a look at it. So, if you have a project that you've just beaten the heck out of and it hasn't panned out, engaging someone with a different viewpoint is oftentimes helpful. And probably speaking for the group of faculty here, if we are writing a letter of recommendation, let's say, for a student who's poured their heart and soul into a project that just didn't pan out, that's going to be, one of the focuses of my letter of recommendation, right? Speaking to the student's dedication to the project or work effort or things like that. That can be translated into information. It goes into a letter of recommendation for if you're applying for a training program.
Yeah, and I would add, there's frequently other places you can send this project to, right? So you submit it to the SVS VAM and it doesn't get accepted. Submit it to a regional society, or submit it to another society, or submit it to a general surgery society. You might be able to find a home for it. And if ultimately it's just a crap project that just didn't work out for whatever reason, be really reflective on why it didn't work out and what things that you could change to make your next project be successful, and be able to discuss those in your interview. So you can certainly discuss the research that you've attempted, and you could talk about, the issues that came up and why you were ultimately unable to achieve it, and how you were going to change things to make it better. So I don't think it's time wasted down the drain. You learn something even from our failures. And so I'm sure, Jason and Bernadette have rejection letters just like me in our emails from journals and societies and things like that. And so it's just part of the game. And I think we learn a little bit every time we get those rejection letters.
Thank you for your answers. The next question will be asked by Thomas Siphon.
Yeah, so this next question, we're going to really, I guess, open to anyone that has experience in this, but how do you see balancing research and clinical duties as a resident or attending physician? And is it feasible to be a physician scientist as a vascular surgeon?
I'll take that first because we're in the midst of recruiting right now, meaning faculty wise. So I've talked to a lot of about to graduate graduates from programs across the country. I think it's a moving target. I think it's an important question. I think I always try to tell students you want to be as undifferentiated as possible when you start out, because you're not sure what's going to stick and what's going to hit. I think having as wide eyes as possible going into this wonderful specialty, and then kind of honing in as you get more experience, you might miss out on something if you don't keep an open mind towards a lot of different things. Certainly the question is directed at the idea as a surgeon scientist, you want to dedicate towards yourself towards likely something translational. And it is harder and harder in 2023 to balance the clinical needs of how busy our specialty is and competing with PhD types or people with significant protected time for grant dollars. So I think that's a very localized phenomenon. And I would just, in the era or in the speak that we all have about finding your passion, finding your love, and being well, I think you do want to do things that make you that satisfy your own intellectual curiosity. And for some of us, it's going to be pure clinical work. And for many of us, it's going to be some hybrid. And for many of us, it'll be pure science. Hopefully you'll have the right mentors that help guide you and give you the opportunities, and then you make an adult decision about that.
Yeah, I think you can find whatever you're looking for as a faculty. You just need to structure your job based off of what you want to do out of life, and even if you're 0.9 clinical, you can still find time, right? Turnover time is atrocious here. So we have tons of time in between cases to do research and things like that. So it's all about time management and doing what you want to get done.
Yeah, well, thank you so much for those insights. And I think we have time for one more question before we wrap up.
Thanks, Thomas. Hi, everyone. It's Kushi again. I think for the last question, we just wanted to ask Prashant and Brian, now that you guys are M4s applying, looking back, is there anything you would have done differently?
So I can start with this. Start going to those conferences early, like VESS, VAM. I always, for some reason, thought that you had to, have a project submitted to go to them or to apply to the student scholarships. And that's not necessarily true. There's a lot to gain from going to those conferences outside of just presenting your abstract. So I think that's that's probably the number one thing I would start doing, like start going to those conferences ASAP. And don't be afraid to reach out to people that aren't at your home institution. I kind of touched on this recently, but I know sometimes it's like intimidating to, reach out to surgeons that are outside your home institution. But I don't know about other surgical specialties, but people in vascular surgery are like nice people, really nice people. And you can probably kind of tell from this panel, but everyone's really excited about training the next generation of vascular surgeons. And I think, any of these panelists and, a lot of faculty outside of this panel would be happy to, mentor someone outside of their home institution.
Yeah, I mean, I would agree with that. And just going off of, I think it was Dr. Hahn's question previously, just about failed projects. I would think I would just try to emphasize that it's important to understand that, failure and criticism is kind of the name of the game when it comes to research. And it's something can be uncomfortable, but it's something to, get familiar with very quickly. I mean, I have yet to submit a paper and not receive, a bunch of comments back and criticism of that paper or soft rejections or what have you. And, it's important to kind of roll with the punches and learn that very early on because, residency can be tough, research is tough. And if just because you can improve the paper in some way or form doesn't mean that you did a bad job initially. It just means that you can do an even better job and to kind of keep your head hung high and move forward.
I just want to put in a plug for joining your regional or national stations because that gets you in the loop and you have this influx of information. So it's one thing to have these scholarship or, travel scholarship or research scholarship opportunities, but you have to know about them. And so being a student member of the vascular organizations will tie you into the information that'll help you take that next step.
Great, thank you so much.
Great, thank you. Thank you, Dr. Olivola, Dr. Lee, Dr. Smeds, Brian, and Prashant, all of our panelists for their wonderful insight. Out of the interest of time, I think we will start concluding here. As we're wrapping up our session this evening, I'd like to take a moment to ask you all to fill out the post survey via the QR code on the screen, and the link will also be provided in the chat as well. And on this slide, we have listed some of the major vascular conferences that are upcoming on both the national and regional level. And these may be valuable opportunities to continue exploring and learning more about ongoing research in vascular surgery. And as Dr. Smeds alluded to earlier, some of these deadlines are in fact quite early. So if you do decide that you want to submit some of your work to some of these conferences and meetings, it is a good idea to take note of these dates early on. And just thank you so much for everyone again who has joined us tonight. If you found this webinar helpful and would like to learn more about our events or would like to become involved in the VESS VSIG, please email us at the email listed on the screen. I'd really like to reiterate that this VSIG is an open group and we are always really excited about new members joining our team. As I mentioned previously, we will be uploading this recording to the VESS VSIG YouTube channel so you can reference it at any time. And any questions that may have been submitted via the pre-survey form or in this chat that we might not have had time to get to, we will also try our best to address as well. So you can find all of that information on the YouTube channel. And finally, I would just like to take a moment to extend one last thank you to all of our panelists for your time this evening. We know you're all very incredibly busy, so we really appreciate you taking the time out of your schedules to come speak with us tonight. Thank you all again and have a great rest of the evening.
Thank you. Good night.
Everybody go to Twitter, JVSCIT tweet chat happening at 7 o'clock.
Thanks, Dr. Smeds.
All right, see you guys.
Thanks, everyone.